Colin, thank you. Ladies and gentlemen, good morning. Well, I'm going to speak to you from the perspective of a private sector organisation that's working closely with a number of public sector bodies. I suspect that not many of you will know of our name, so allow me just to put up a few things that we do. Some of these will be particularly relevant to you. Some of these you'll wonder what on earth I'm talking about. Trying to describe what we do in a sentence is always tricky for businesses. This is how we describe ourselves as a customer engagement agency. And we help organisations, whether public or private sector, to engage more intelligently with their stakeholders, customers, citizens, whoever they're interacting with. And a big chunk of our business is to do with managing risk, particularly from the credit perspective. Here are a number of organisations that we work with. I don't have time to tell you about all of those. We have a stopwatch here, which I'm curious to know what happens when it gets down to zero. Maybe my presentation will be the one that finds out. Here are some organisations that we do work with. I'm going to drill into just one, which is the Stop Smoking programme that we run for, or we partner in with the Department of Health. This just simply gives you a flavour of the kinds of things that we do. I'm then going to go on and explain some of the considerations that I think should be brought to mind when looking at the case for shared services internally, as opposed to, as Rob was highlighting in the end of his presentation, about partnering with a private sector organisation. Here's the government's, the Department of Health Stop Smoking programme. And those are the objectives that you can see there, fairly self-explanatory about reducing the number of adults who are smoking in the UK. There are various target groups, as you'll see at the bottom there. These tend to rotate around, so a number of campaigns focusing, for example, on manual workers, on pregnant women or on young people. This programme, we have worked with the Department of Health now for the best part of 10 years. We provide a number of services, including live contact centre services. Sometimes when they run a direct response TV campaign, the requirements on us shoot up. So in some cases, when we're taking something like 3,000 or 4,000 calls per day from consumers wishing to give up smoking and looking for help through the services that we provide. Because it's a public-facing service, accessibility is key. So our contact centre then is available for this particular programme, 7 in the morning till 11 at night, 7 days a week, 365 days a year. Another point I'll touch on in a few moments is that the channels to market, or the communication channels, have to be the ones that our consumers are using. So it's no good making everything available by telephone for young people who want to do everything, as you know, as I know from my son, that everything is done by mobile phone, by text and web chat and those kinds of services. Underneath all of this, we sit a CRM database that enables us to track the history of all the interactions with any individual across any of the channels and how they've interacted with us. This is the main website for the Stop Smoking programme. A number of things that you'll see on there. The fact that it's multi-channel at the top there, I think it highlights the free phone number that will contact us on our agents. You'll see in the middle the iPhone with the text application. So, for example, if somebody's giving up smoking, one of the questions our advisors would ask is, when are you most likely to be tempted to start smoking again? If they say Friday at 4 o'clock, because we always go to the pub for a drink at the end of work, then they can choose to have a text message at 3:45 that says, you've made it through the week, don't give up now. Sounds corny, but actually is very, very effective. It's in the channel and the timing and in the means that particular consumer is looking for. One of the important things about outsourcing to a private sector is that it has to be measured. We are keen, as an example of an outsourced organisation, that we have to understand whether this programme is working. That puts onus on the public sector body providing it to us to understand what the metrics are required. But here's some results of some analysis that was carried out jointly with ourselves and the Department of Health last year. We looked at these three particular groups. The control group basically had nothing done to them. The middle tier had some limited communications. And the top tier, programme group number 1, had basically everything that we could throw at them. And the results of their quit rate, because we follow up after somebody has given us their target date for stopping smoking, we would check to see whether that has actually been happened and carried on, stop smoking. And there we go, there's the control group. And so some quite satisfactory outcomes there. It's important, as I say, that these are measured and fed back to our organisation. There's also some independent analysis run. I won't spend too much time on this one. This is I think this is the marketing magazine that carries out mystery shopping, so it would ring through onto the helpline and pretend to be one of our customers to try and give up smoking, walk through the whole script and see what the outcome was. And so an independent measure, and they very kindly gave us 10 out of 10. Now, I want to move on to the core of my message, which is that the shared service agenda, I think, has been far better articulated by Corinne and Rob than I will ever do. I think the reason that you're here is that clearly there is an agenda, there is an imperative, a business imperative. We have partnered, as I say, with a number of public sector organisations for a number of years, and I would like to suggest 7 considerations that you might want to put into the mix in considering whether to in-house, or to take it in-house, whether that's a single authority or perhaps pooling, or to outsource it to a private sector organisation. Some of these will be fairly obvious, some of these may not be. The first one I put down here is economies of scale. I would imagine is fairly obvious. One of the issues that we have is that many of our clients don't know what the volume of work that is going to come through. So particularly if we share, if you were to pool a number of similar, say a number of agents in one local authority, pool them with 2 or 3 adjacent authorities, you may well be able to fairly accurately predict the call volumes or the activity volumes, but in some cases you may not. I'll get a couple of examples that I'll show you in a moment, but a number of our clients need us to have that flexibility to gear up and down over a period of time to help them. The second one would be what I've called current best practice. As an outsourcer, we're required, it's our business, to make sure that we're up to speed on the latest developments in technology, in workflow management, in process management, because we need to supply those in order to stay ahead of the game with all of our clients, regardless of public or private sector. So we are continually investing in these tools and efficiencies, and the benefit to you is that you can take the benefits that they bring without having the hassle, the time delays, the IT hassles and so on of implementing such tools. Thirdly, there are various process efficiencies that we can bring to bear. We have the advantage, I guess, in the nature of work that we provide of having a highly flexible and adaptable workforce. We have to do, because we can be called on at any moment to suddenly gear up from 300 to 500 agents, and we have a day's notice to do so. So our workforce management is highly flexible and adaptive, and again can be a particular benefit to you.